The big story of the hour is the spike in the number of cases across Karnataka. There has been 116 fresh COVID-19 cases that has been reported in Karnataka. 74 cases out of 116 cases has a Maharashtra link. 25 COVID-19 cases reported from Udupi, 15 COVID-19 cases reported in Mandya, 13 COVID-19 cases reported in Hassan, 6 COVID-19 cases reported from Bengaluru. Total number of deaths in Karnataka rises to 41. Total number of COVID-19 cases in Karnataka rises to 1,578. So this is the big news that is coming in at this point of time, that a majority of the cases coming today from Karnataka has a link to Maharashtra, and this is definitely causing a headache for the state government as of now. 74 cases out of the 116 cases has a link to Maharashtra. Maharashtra is going on and proving out to be a viral thorn for the state of Karnataka. For more on this, I'm also joined in by my colleague Abhijit. So Abhijit, clearly going ahead and looking at the number of cases that is coming in from Karnataka, we have been averaging 100 from the past 5 days, but also going on and looking at it, majority of these cases that has come in from 16th of May all have a connection with Maharashtra, and coastal Karnataka along with Mandya and Hassan has been the worst affected too, and not to forget Belagavi, which is also the neighboring district of Maharashtra, has been worst hit too, and this is turning out to be a huge headache for the Health and Family Welfare Department authorities in Karnataka. What more do you have to say?
Absolutely, Prajwal. Headache it is for not just for Karnataka but also for the people across India. But what I would like to say over here is, the number of cases as per the WHO, like each and every prediction is actually coming true. We were expected to enter the 1 lakh club by May, which we have, and now the number of cases in Karnataka has actually gone past 1500, and after a dip in number of cases as compared to the last 4 days where we had over 80 cases, over 90 cases, over 140 cases, and then yesterday we had a total of around close to 70 cases. Now again we have breached, Karnataka as a state has breached over 100 mark yet again, and no prizes for guessing. The biggest contributor in this has been Maharashtra, and as you rightfully put forward, Maharashtra has been a thorn for Karnataka as far as the COVID-19 is concerned. Because if you see the number of cases, and I would like to just read out the numbers again for our viewers. As you see, Hassan, we have 13 cases, Mandya we have 15, Bengaluru has reported 6 cases, Dakshina Kannada has reported 6, Udupi has 25 cases, Uttara Kannada has a total of 9 cases, so Belagavi 5, Dharwad 5, Mysuru 1, Ballari 11, Shivamogga 6 and Vijayapura 1. So a total of 12 districts in Karnataka has actually reported COVID-19, and out of all these 116 cases, 74 cases is courtesy of Maharashtra. And so what can be done? So now what can the state government actually do in order to ensure that the numbers are kept in check? Remember, we have very limited medical staff. We are not we still, despite all the advancements in technologies and medication, we still don't have the capacity to match China, where they just built a 1,000-bed hospital within no time. Do we have that? No, we don't have that. Let's be very honest and let's face the truth. And also, the state governments needs to keep the numbers in check, because once the number or the patients explodes, the number of total patients explodes in the state or even in the country, then things will automatically go out of hand. And don't remember, and I beg your pardon, and don't forget that we are in lockdown 4.0, and mostly in all the states restrictions have been eased down. So the challenge for the paramedical staff and all the officers out there is even more now, because remember, during the lockdown phases 1, 2 and 3 we had limited number of cases coming in, but now when the restrictions have been eased out and when people are out there on the streets, we don't know. And for the latest reports, over 69% of all the patients which have been reported are asymptomatic. So that's even a bigger threat, not just for Karnataka but also for the rest of the country. So clearly the condition is worsening in the state. One has to remember that, but also on the same hand, one also needs to credit all the paramedical staff out there which is working in tirelessly in order to ensure that we stay safe. But overall, yes, Maharashtra link is hurting Karnataka big time. And if you have 74 cases out of 116 odd coming out because of one reason, maybe due to migrancy and maybe due to other factors involved, then there is certainly something to be worried about, Prajwal.